Welcome to this installment of Health Communication. Today we're going to be talking about social support. So, one of the most important factors in determining whether a patient's treatment is effective is social support. Relationships with family, friends, and even acquaintances can have positive effects on physical and mental health. Thus, it's important in looking at healthcare to look at the different types of social support that are available and sometimes unavailable to patients, and the positive and, of course, negative functions of each kind. Now, your book lists several types of support. We can start with instrumental support. And instrumental support are basically tangible types of assistance: money, help with a project, meals, or transportation when someone's ill. In terms of the positives for this kind of help can be crucial. If you're unable to manage on your own, instrumental support can be the difference of survival. But on the con side of it, it can feel patronizing. It can undermine people's feelings of self-sufficiency. They can feel infantilized, and it can lead to a certain kind of learned helplessness where patients end up relying on other people to do things for them that truthfully they could do for themselves. Another kind of support to think about is informational support. And this is really, information about an illness or treatment that people receive from friends, support groups, or caregivers. The benefits of this, it can give people a feeling of more control. They can use the information to become educated about their illness and about their own care. But on the other side, it can often be unwanted, particularly when this is from friends and families who are just giving you unwanted advice. It can be inappropriate. Certainly anyone who's had an illness knows about the family member who sends them emails about the latest cure that they found on some health website that probably is not appropriate. It can really make a patient feel overwhelmed and worried. So, or just annoyed and not wanting to talk about it. So informational support is one of these really tricky things. Another type of support is emotional support. And in emotional support, this can really just be the simple act of listening to a person's concerns and troubles, validating their concerns and fears, offering them encouragement, just being there. Now, in terms of the positives of this, people really respond positively to emotional support, much more so than informational support. It helps people deal with stress and the distress of illness. But, of course, emotional support can be difficult to pull off. On the negative side, it can be done ineffectively. Partners or friends who attempt to solve the crisis or maybe minimize it in an attempt to make the person feel better. This actually isn't very helpful, not surprisingly. And so often we want emotional support, but the people we want it from are really incapable of delivering it in the manner that we need. And of course, when you're at your best, sometimes it's difficult to ask for emotional support. And when you are feeling low, it may be even more so. Another type of support to think about is esteem or appraisal support. And this is really related to emotional support. And essentially, it's helping people deal with illness and stress, feel validated that their problems are legitimate. And this may seem like a minor thing, but particularly for people whose illnesses face a social stigma, like mental illness or HIV, eating disorders. Esteem support can improve people's feelings of self-worth and diminish isolation and depression. Saying, you know, I hear you, I believe you, I am here. But like emotional support, esteem support can be difficult to pull off sometimes. Not everyone views the situation as a legitimate problem, or they might view the individual as partly or mostly to blame for the situation. As such, the provider of the esteem support may not be the ideal person to give it. So esteem support is often something that's better in support groups than from family members or friends. Sometimes even healthcare providers themselves are better able to provide this kind of support. Now, stress is a huge part of being ill. And we know that stress has a negative effect on people's health. But people handle that stress in different ways, and they approach their illnesses in different ways. So we can talk about different strategies for coping with illness. One is problem-focused coping, and these are strategies that are directed at remedying the situation, getting tested for a disease, changing your diet or your lifestyle, things that address the particular issue. It may involve taking medication. It may be about researching new treatments. All of these are connected to problem-focused coping. Another type of coping is emotional-focused coping. And this is where, you know, people vent their frustrations. They express emotional responses as opposed to attempts at remedying the situation. So complaining about your illness and the need to change your diet and exercise as opposed to actually doing it. Now, it's not that emotional focused coping is bad on its own. Sometimes it is really helpful just to vent. But that's different in that sometimes if you're doing venting in conjunction with problem-focused coping, you're doing a lot better. Then that may just be the emotional support you're receiving. Emotional-focused coping is really about talking about things all the time without actually engaging in any attempts to really change things. Now, another type of coping is avoidance coping. And this is where people really disengage mentally or even physically from threatening situations. They avoid information about their health condition and they don't seek out solutions. They may divert their attention to other things that they find more important or pleasurable. Now, if you were to rank these three, you probably would think that avoidance-focused coping is the least effective. But while it's pretty clear that problem-focused coping strategies are the most effective, it's often surprising to find out that it's emotional-focused and not avoidance-focused coping strategies that are really the least positive in terms of outcomes. It turns out that avoidance sometimes works. Sometimes denial is a viable option for people. Now, I'm not suggesting that that's the way to handle all issues, but particularly with people who have terminal illnesses, dwelling on their mortality doesn't actually help. So by focusing their attention on other activities and interests, it improves their health, lowers their stress levels, and really improves their quality of life. And so those are important things to think about. Now, to a certain degree, our feeling about our coping strategies are subjective. And what works for one person doesn't always work for the other. Now, this also brings us to social comparison theory, which posits that people make assessments about their own health and coping mechanisms by comparing them to others in their social network. Now, as such, there are different types of comparisons that one can make. You can make a lateral comparison, and these are comparisons that you make between people who are at a similar level of coping as you. So people who have the same illness and seem to be doing about as well, they're similar to you in many ways. And this can make you feel good, normalize what you're going through. You could, however, be making upward comparisons in which you're comparing yourself really negatively to people who you think are coping better than you are. And this can result in feelings of negativity and frustration. On the other hand, it could inspire you to try and cope better. It really depends how you interact in that upward comparison. Similarly, you could be making downward comparisons. And this is when you're looking at others who you feel that aren't coping as well as you are. And by looking at them, comparing yourself, you can feel better about yourself. Now, it may make you feel negative about people who actually are more lateral. They're really more your peers. Maybe you're looking and saying, well, these people, they're not doing really well. I'm doing so much better. And in that way, you might be distancing yourself from possible support. Now, in terms of navigating supportive relationships, it's really important to have reciprocity. And reciprocity is often an issue in supportive relationships with people who are ill. Just as in friendships, you can react negatively if you feel you're always giving and never receiving, the opposite can also hold true. If you feel that you are always receiving and never having the opportunity to give back, you may find yourself unhappy with the relationship. So reciprocity is really important. And what can happen is that with people who are being cared for, they always have to receive, and they begin to feel over-benefited. And this can lead to feelings of inadequacy, helplessness, and demoralization. Similarly, caregivers often end up feeling overburdened by this dynamic as well, and they don't necessarily feel that there's a safe space in society in which to discuss those feelings. And this is why maybe social support groups are so helpful, because on and offline they give people places, spaces where they can say the things that they're feeling, that other people in the room will understand what they're going through. These groups often create a safe space for saying the things that, it's hard to say even to yourself. If you are the person who is receiving so much support, and that can be a problem for you. And similarly, for those who are caregivers, it's often frowned upon to say negative things about people who are ill, although you may be very frustrated and unable to handle all of the stress. So social support groups that give you the space to do that can be very important for your well-being. The last thing I want to talk about are support networks, and these are a little different than the social networks that Southwell is talking about, but they are, of course, connected. So there are two types of networks that we can talk about: strong tie networks and weak tie networks. So in strong tie networks, these are usually family and friends, a close network with long histories together. And positives of this, these are often the people who are best placed to provide physical and emotional care due to proximity and to history. But On the other side, sometimes we don't actually want close family and friends to know about issues related to stigma. So alcoholism, mental illness, sexually transmitted diseases. And so there can be a real negative association with those strong tie networks. So we also have weak tie networks, and these are usually between people who communicate frequently, but not in an intimate way. Neighbors, service providers, internet groups, support groups, church or community groups. The benefits of this are, of course, that we have a lot of diverse points of view. Perhaps there's more knowledge of the illness. There's also less emotional attachment in the group, so individuals in that group may be more willing to have honest discussions about weighted topics. And also, people with illness may be able to have those conversations because they don't have to worry about sparing the feelings of people in those weak tie networks, unlike how they might worry about family and friends. And there's less conflict over role obligations. Now, of course, one of the things about these weak tie networks is that they may not be quite as reliable because there's less history and maybe just sort of less reciprocity. But in general, the positives of these weak tie networks seem to outweigh the negatives, with over 25 million Americans using support groups for help with illnesses. And when we think about these support groups, should figure out what it is that makes them so popular. Part of it is that people have difficulty communicating about illness in their traditional networks. There are aspects of illness that really are best understood by those who face similar conditions, whether the symptoms of the illness, the side effects of the treatment, or the impact of the illness on the relationships in the patient's life. Illness may also make people feel alienated from their old social networks. Illness makes many people feel uncomfortable. So it tends to remind people of their own mortality. And so a surprising number of friends may end up avoiding contact or engage in communication that minimizes the feelings and condition of the person suffering from the illness. So that can be a very painful thing. And in these support groups, that's just not part of the dynamic. A major benefit of these groups is the way in which they allow members to engage in reciprocity. Whereas they are always the patient in strong tie networks, within the support group, they can provide information and be the source of information for others. This ability to help others reduces feelings of powerlessness and increases feelings of self-worth. A major way that people actually use these groups as well is through narrative. By telling their stories, they're able to give and gain help. The narrative format is often felt to be more credible than straight informational format that providers use. And additionally, narrative can help structure events for people for whom the illness has made their lives seem chaotic. The imposition of a narrative structure on what's going on in their lives helps them feel that there is an order to what's going on. Now, in general, support groups have tended to be white, middle class, and well-educated, but a lot of this is changing now with internet support groups. And it should also be noted that it's often difficult to obtain accurate demographic information about membership in support groups due to confidentiality of many of the groups. Now, we also know that there's been a proliferation of internet groups and that this has changed the dynamics of health communication and support groups. Scholars have referred to these as unbounded networks because unlike face-to-face interactions, they're not bounded by time or geographic restrictions. They also qualify, though, as weak tie networks. Online groups may be especially helpful for people with social phobias and reduced mobility, or for those people for whom race, age, gender, and appearance may be barriers to forming relationships. Because of those reduced visual cues, people are actually able to engage in interpersonal discussions with less interpersonal risk. And some scholars have found that people actually tend to form really intense relationships online, what they've called hyperpersonal interactions. The idea is that people put out their best possible selves, images of themselves, which then allow their communication partner to idealize them. And this happens in a feedback loop. So the relationship is thus hyper-personal and more intense than offline communication that's often complicated by external realities and environments. Now, that actually happens not only in support groups, but also in online communication in general. All right, well, we'll pick this up next, talking about social networks.